Federica, for anyone that doesn't know you, who are you and what do you do?
Wow, good, straight in there. So I'm a medical scientist and a registered public health nutritionist by training. So I am the head nutritionist at ZOE. I also am the director of all their comms and partnerships. And I'm the nutrition leader at Imperial College School of Medicine, so I teach medical students nutrition. Mm-hmm. I am the head nutritionist and sort of clinical nutrition lead for Well-Founded Health, which is a medical concierge company. So we really look after patients in a 360 approach. And I write books as well. So those are my main activities. I have 2 gorgeous girls, and I love being their mum.
That is a lot of things to tackle. And so how did you actually get into, I'm hearing the common theme is kind of the nutrition side of things.
Yeah.
So how did you get into nutrition? Why were you interested in it?
Yeah, so I did public health for a long time. So my initial training was in biomed sciences, then pharmacology. I'm very interested in how different molecules and compounds could affect our health. Then from there, I went into public health. And that's because I was very interested in medicine. But one of the things I noticed while I was doing, I looked at a lot of clinical placements when I was younger, throughout my university life. And it just made me a little sad to see that most of the patients I came into contact with they could have prevented being in hospital in the first place. So I think for me, doing hospital placement was what pushed me away from medicine and towards public health, which is essentially more upstream. Mm-hmm. So when you think about I've always had a desire to help people to improve health. My mum's a doctor, so it definitely came from her. And I absolutely love learning, I love science, I love understanding the human body. And so I thought the obvious choice would be to do medicine. But the more I spent time in hospitals, the more I was like, actually, this is really late. By the time they get to you as a doctor, and of course now this has changed a bit, but at the time, what I could see was like, you're at the last bit. Yeah. And there's actually a limit to what you can do to help at that point. Mm-hmm. So that's what I was speaking to one of my mentors, and I said, what can I do that actually helps prevention? I want to do preventative medicine. How do you do that? And that's not an official degree. We're going back a few years as well, so this is quite a long time ago. And they were like, well, no, but we do have public health. And I said, well, what's that? And they said, well, public health is working at population level to try and prevent things. I was like, that sounds great. I want to do that one. At the time, so this is 2009-ish, no one was doing public health. I mean, people were, but it was not a thing. Yeah. So I was one of 24 students that did the Masters in Public Health at Imperial College.
Wow.
And I was the youngest. So everyone was already a trained doctor, or they were already like people who worked in the field, for example, abroad, with Médecins Sans Frontières and charities like that. And then it was me. And I was really excited. It was brand new to me, and it was really brilliant. Yeah. So that's where I knew that was the right course for me to do public health. Now, whilst I was studying, and then I worked with the WHO Collaborating Centre, I became really interested in nutrition because I went to this lecture by this really great professor called Elio Ribili, and he was the director of a big cohort trial, which means like following people up for many years to see how their health changes, called EPIC. Mm-hmm. And they were really interested in looking at exposures and then cancer. And I was sitting in his lecture, I just remember this, I was like a front row student, no surprises there. And I was sitting in his lecture and he was telling us about the latest finding from his cohort trial that showed that people who consumed the most processed meat had the highest risks of colorectal cancer. And I was sitting in this, I just remember sitting there being like, what? And like sort of turning around and looking to my fellow students and being like, did everyone hear what we eat causes cancer? And I was just so shocked by that. But I was shocked not by the science itself, because it all made sense, but I was shocked by how that wasn't known. Yeah. I was like, people don't know this. It should be really important, like front page news, especially because the EPIC findings weren't the only ones. Like this was just adding to the body of knowledge that already kind of existed, that this was happening. Now fast forward 15 years later, and we're still having this conversation. Like people are recommending processed meat as a good protein source, where we've known for decades that it increases the risk of cancer, right? So that was it. I was sealed. I was sold. I was like, right, so public health is what I want to do. I want to prevent disease as much as possible. I want to help populations improve their health by changing modifiable factors upstream. And nutrition for me just unraveled as the obvious choice because it's something that most people have some control over. So I did a lot of work in mental health, public mental health. The PhD I did in medical sciences, the data set I had was 9 million patient points in mental health services.
Wow.
And my work centered around trying to find a way to predict patient outcomes. So I've always been very interested in personalizing healthcare. How can we personalize advice, personalize intervention to improve outcome? And when I was doing this work for the mental health patients, I was like, wow, it's actually really hard to change some of the factors that influence mental health outcomes. But one of the things that shone through as a modifiable factor that most people had some control over was food, nutrition. And so that, again, steered me towards wanting to do a nutrition master's, not because I didn't have the skill set to do my own research, but I really feel that nutrition is one of these fields that has a lot of noise. There's a lot of people who are nutritionists or who give nutrition advice who don't have the required qualifications to actually say, no, I've had enough education in this. And, Imperial College doesn't offer a master's in nutrition. It didn't at the time. There is now like a research one that's offered. But at the time I said, I'm going to have to go to another university and then come back to for my postdoc. So essentially I did that. I went to London School of Hygiene and Tropical Medicine, did my master's in nutrition there, loved it. One of the best years in education of my life, loved it.
Why was it so good?
It was it's a great university. So I think I'm really lucky. I did my undergraduate at University of Edinburgh and my honours, and I loved Edinburgh. It was great. Imperial obviously was awesome, still is. But there's something about LSHTM, it's a small university. It's only postgrad. So you have people who essentially have really chosen to do that degree. I think with undergraduate, of course, a lot of people just do it because you're supposed to or you're like expected of you.
And you don't really know what else to do at the time.
And you don't know what else to do. So it's a small school. It's just brilliant. Like the teaching is unbelievable. By the time I did my master's, I had finished my PhD. So you'd think, and I did a big data set PhD. I learned things in my master's epidemiology lectures and statistics, especially statistics, which I was like, wow, I wish I'd known this before.
Well, give us a few examples.
Oh gosh, I can't, it was just like the way that you could code certain things into Stata. That would have saved me so much time. It was a really good degree and a great vibe, to be honest. So I did that and then I went back and started integrating nutrition into my public health work at Imperial. So that was it. Since then, I've been working hard to sort of continue with nutrition. I've done research in nutrition. The gut microbiome is a big area of interest. Why? Because the gut microbiome explains how nutrition as an exposure has so much to answer for in terms of health effects. So it's this real it's the intermediary, right, between what we eat and health. And so I've been able to continue with that. But I think because my background is in public health and medical science, I consider nutrition the best tool, but there's wider factors to nutrition that influence health, and it's really important to keep those in mind. So I often speak about the exposome. Like, think about all the exposures that you're subjected to. It's not just food. Food is just the one I find can be really helpful as a tool to influence change, but you have to be aware of the others as well.
And for example, what are the others? Are you thinking about along those of physical exercise? Is that kind of thing?
But also things like air pollution, but not just air pollution, like what is the air quality like in your home? So things that actually influence your health every single day and that often are a little bit overlooked. Exposure to natural sunlight, how much are you getting that every day? How is your sleep environment? What are you using on your skin? What are you using to store your food? Like that does go back to food a little bit, but there's lots of things that are exposures that we then come into contact with throughout our day that have quite a big effect on our health overall.
And you mentioned the processed meat causing cancer. That's, I mean, even that, like, that is shocking.
Well, yeah.
And the fact that that is
It's
not
old news.
public knowledge.
It is. It's a class 1 carcinogen by the WHO. Like, it is, but it is technically public knowledge.
But that's not, because public knowledge is like very different than to actually what the public kind of perceives and knows and actively has in their everyday kind
sphere,
of.
yeah.
So why, and also it's interesting that you speak on the mental health side as well, because then you're looking at kind of the psychology. Why is it that people are not more aware of these things? Like, why do we not seem to really care about the fact that all of these things are causing us harm, are causing cancer?
Well, there's a few things, right? First of all, overwhelm. So often people are like, well, everything causes cancer.
Yeah.
I get that, right?
I'd even say,
so this is actually the book I'm writing at the moment is how do we weigh up the size of risk of all these different exposures?
Yeah.
Because some things are really worth changing your life for, and some things are like, if you've got time and you've got space, then it'd be really nice if you could do X, but it's not going to move the needle massively. So we have to contextualize which things are going to really move the needle a lot, right? So there's overwhelm. The second thing is that often public health advice is not delivered in a way that's actionable. So me saying to you, processed meat is a class 1 carcinogen, like eating it contributes to increased risk of cancer. Okay, cool, what do you do with that information?
Yeah.
Okay, what's the actionable steps? Okay, so, well, if you're currently eating bacon with your breakfast like 4 times a week, how about reducing it to once a week? Can you find a way to reduce that? Or if you're packing, your kids' lunches with salami stick and ham in the sandwich, how can you change that? What can we replace it with? Do they like other sandwich fillings? So would you rather change the sandwich and keep the pepperoni for, I shouldn't name brands, but like salami stick for a bit? Or actually, could we replace the salami stick? Maybe they love breadsticks and hummus. Yeah. So you have to meet people where they are in terms of actionable advice. Now, so that's also part of it. So there's a little bit of despair of like, can't have this, can't have that, can't have that. So that's why a lot of the work I do when we come to communication science is about what you need to add more of. As soon as you add the foods that actually protect your health, often the foods that are less beneficial tend to drop off a bit. And I find that positive nutrition advice is more helpful than telling people what's going to kill them all the time. Because it's just also, as I said, people just go, well, whatever, I'm just going to do it anyway. At least I'll die happy. Do you know how many people say that? At least I'll die happy. I'm like, okay, cool. So you have to weigh up, like the evidence needs to be communicated really clearly. Yeah. There's also this important point of, you're talking about relative risks. So if you're someone who, increased risk, relative risk is like 70%. It might be a very small number still, because if you're increasing from like 1 to 1.7 out of 100,000, I made those numbers up. It's not a huge increase in actual numbers. So it's also understanding, okay, what are your other risk factors for this? For me personally, colorectal cancer is a massive problem. My dad died of it, so I'm especially aware. So do I ever eat processed meat? Hell no. But I'm aware of my family history. I'm also aware of it doesn't bother me. So I cut it out. I don't miss it. You have to weigh up what matters to you and what your health priorities are. So there's a little bit of personalization that does have to go into these considerations. And when we give advice, or even if you put it out to the public, just say to people, if processed meat is a huge part of your life, just look at reducing it. Don't go straight to cutting it all out, because you'll find that quite tricky. And then focus on what you can add back in instead. So that's one example. I mean, and then the third thing to say is, it's hard to navigate what actually matters and what doesn't, because marketing, advertising standards don't help people make better choices. So when you go to a supermarket and there's an entire deli meat aisle, well, if they're so bad for you, why is that allowed to be part of our food environment in such a prominent way?
And why do they look so fun and colourful?
And why does it and this is where Chris Van Tulleken feels very strongly there should be health warning labels on certain foods. And, there's a good argument for that, because look what happened with smoking, right? With smoking, everyone knew it caused cancer, but when you were allowed to market it and advertise it, and all your favorite film characters were smoking, people still smoked. As soon as you put really quite horrendous health warning labels on pack, and you made selling them illegal unless it was behind a counter, So it has to be behind a counter. It's not advertised and marketing is not allowed. Smoking numbers have plummeted. So we know what works, right? If we want people to eat less processed meat and we want them to drink less soda, we know the levers that work, but that hasn't happened here. It's happened in other countries. If you go to Chile or you go to Brazil, you do get health warnings on the worst foods, and people have bought less of them.
And then from the communications perspective, you said something earlier, which is that we should be telling people what to add to their diet rather than take away. But obviously people do not want to know what to add. They want to know what's going to kill them, and that's what's actually going to go viral, and that's what's going to hook people in.
I think it's less what people want, and it's more what gets clicks, which is different.
Exactly, yeah.
So it does grab attention. Negative headlines will always grab attention because fear, unfortunately, we respond to fear quite well. So then when you're working with media, it's that knowledge is important, and then the hope is that people read past the headline, and then the content of the article or the post has more information on what to do about it. But yeah, I don't know. I think we are I think social media has created a bit of a fear-bait culture. Yeah, for sure.
Yeah. And how have you, kind of as being head nutritionist and head of comms at ZOE, how do you tackle that bit where you know that it's going to perform better if you're doing fear-based
so we
messaging?
We don't engage in it. When we work with journalists or other people who are platforming us, then it's about what the content is. Yeah. So if you were to clip this and say, processed meat causes cancer as like the clickbait, then hopefully people will listen to the conversation and hear the nuance. But you can't control how other people edit your work. So it's just making sure that what we actually put out is very much on the positive foot, and here's how you can help improve your health. We're working on one of the largest early colorectal cancer research groups that exist at the moment. Professor Sarah Berry, she's leading some of the trials to see whether we can intervene early and sort of reduce the risk of early colorectal cancer. Really important work, right? So we're doing a lot of positive work with international colleagues to try and understand, like, what can we do about this risk? What is causing it? So there's another group, colleagues in India and in Italy who are looking at, like, what is increasing the risk? And then how can we do something about it? And communicating those things is really important in a way that people can then action them. So all we can do is put out content that's less fear-based and more solutions-driven. And then hopefully everything we do is solutions-driven, even if the headline ends up being fear-based. Happens all the time. And the more you work with media, the more it's important to say, like, the headline is actually out of our control. It gets chosen by the outlet and they test it, and it's the one that performs best. So the most important thing we can do as communicators is ensure that what we've communicated is useful. And then hopefully the clickbaity headline will mean that more people listen to the useful stuff. So you have to sort of change the framing. You can't blame editors for choosing the headline that's going to get the most reads. That makes sense, right? So it's just working with it.
And then on the front of the kind of warning labels, I remember being in Mexico and actually seeing the sugar packets, like any types of candy would have the
big,
warning label.
The octagon,
and it is kind of terrifying. You look at it and you kind of don't want it as much. Why do you think in the UK we don't have that?
Well, because you would need the government to essentially say, okay, we're going to do it. So there's a few things. People will give lots of different reasons. Oh, well, it's really hard to define what triggers the warning label. No, it's not. Other countries have done it. We don't need to reinvent the wheel. We could just try the same wheel. If we want to reinvent the wheel, there's lots of novel tools that we can use. So actually at ZOE, we've developed a novel tool called the Processed Food Risk Scale, which helps to understand which ultra-processed foods, which processed foods are the highest risk category. So if you're worried about lumping all ultra-processed food together, because some of them are actually not that bad, and some of them are definitely bad, then we've got new tools that are more refined. The Chilean example in Brazil, Mexico, they use a combination of ultra-processing and high-fat salt sugar. It's a slightly older tool, but still it helps you to sort out the ones that need to have a bit more worry about them, essentially. And it's just about steering people away from the foods that are more likely to cause harm if they're eaten regularly. Because also, like, no one can of soda and no one piece of, rubbish processed food lunch thing is going to do the harm. It's about habits. It's about consistency. So if we can move people away from consistently buying these products, it's going to help. And when you remove the cartoon characters, when you remove the nice front of pack marketing, source of vitamin D, whatever, there's so many of them, high in protein, right? Then it becomes less appealing. And then if on top of that you also whack a big label saying, actually, this is really high in saturated fat and sugar, you're like, oh, actually, I'm not going to have that. So it's simple. Here, we haven't got to the point where the government is ready to take that step. Why? I mean, the food industry is a huge part of our economy. So we've got to, not we personally, but the government has to work with the food industry to get to a place where it works and they can do it. But these countries that have done it especially South America, they've just sort of gone, well, figure it out and get on with it. So it is about whether you prioritize public health or do you prioritize industry profit. And we have had decades of prioritizing economic growth over public health.
And what do you think would need to change in order for that actually for the entire...
I wish I had the answer to that. I think we need to have a government that's really invested in prioritising public health as the number one thing to change. There are so many competing priorities: education, transport, improving our emissions. There's so many things. Like if right now you had someone sitting here who was like an educator, I am an educator, but if someone who actually was in that, they'd be like, well, education is the number one thing. If you had someone who was really an environmental activist, they'd be like, well, the environment is number one. So it's like one of those questions where...
But we said with the NHS 10-year plan, we said we want to make healthcare more preventative. And so it's funny, you say one of the biggest levers we can pull with making healthcare more preventative is the nutrition side.
100%, yeah.
And yet we can't really fully commit to that.
No, although this government has made some moves towards baby steps, towards changing something. So they are introducing the advertising ban for fast foods, and they're talking about marketing restrictions for certain foods. So they're doing something. I still, it's a shame. The last government had Henry Dimbleby produce an excellent report that had very good solutions. And then COVID hit and it was sort of torn up and thrown away. And so there's dozens of policies and papers that have been written. There's over 200 different policy ideas that have been put forward to help reduce childhood obesity in the UK, right? Very smart people have already given a lot of their time to give solutions. So it's just a case of somebody needs to own it and say, yeah, we're going to do this. Actually, this is a massive priority. So the Prime Minister, but also we need a health minister who really understands the issue and implements change. It's hard to do, to be that person. I always say, and I might be wrong, but I do think political will is the number one ingredient for something as big as like warning labels to come to fruition. So, but in the meantime, there's so many other things we could do. There's education in schools. Like nowadays, children aren't taught about healthy food. They're not taught to cook in schools. So you have a generation that doesn't understand the importance of healthy food. Essentially, the schools themselves. There are some healthy eating standards, but they're not obligatory. So you can kind of sign up to do it if you want to, but otherwise you don't really need to. And, we know how important good nutrition in early years is. It's fundamental. And it helps. Those children are then set up to become adults that are more likely to choose healthier foods. So there's lots of bits that could happen, even without the massive warning label rollout, which you can imagine is just a harder sell when you have a lot of industry shouting very loudly about how that we shouldn't do that.
And so there's kind of like two sides to this. There's the food industry with the labels and the cartoons and making kids want to purchase that.
Kids and adults.
Yeah, and true.
Okay. And adults will spend roughly between 20 and 40% more on the same product if it says high protein on front of pack.
Wow.
And there's a cost of living crisis. So you can imagine people are spending their good hard-earned money to buy an ice cream that's high in protein.
Yeah. And it might have
that
the
is not a
exact
good
same
protein
ingredients
source.
as the one not high in protein.
It will have a bit of whey added in or something. So it's not just children, it's everyone. We all are influenced by food marketing and food advertising. And for me, like, obviously working in like comms and stuff, if we could just make the regulations on what's allowed to be marketed and advertised much stricter, really just have someone be like, okay, you know, I'm going to call out, Cocoa Pops should not be allowed to market itself as the healthiest start for your whole family.
Yeah.
But it is. That's what's on the front of pack right now. What? That shouldn't be allowed.
Yeah.
Cocoa Pops are doing their job, marketing their product, but there should be regulations where it's like, well, no, we don't actually feel this is responsible for public health. Then I think we'd get a bit further.
Quick break from the show. If you're a healthcare professional or a consultant and you want to build your online reputation and a personal brand so that you can get advisory roles, NED roles, or even if you're looking to position yourself as the authority in your field and you want to get speaking opportunities, then a personal brand is the way for you to go. We have a program called Digital Healthcare Leaders where we teach consultants and healthcare professionals exactly how to do this. So if you're interested, check us out on LinkedIn at Dasha Angelova or Martini Sue, or if you have any questions, feel free to shoot me an email at dasha@talkingpulse.com.
And what the consultants really love about the program is that we have digital healthcare leaders from all different types of verticals, gynecologists, dermatologists, oncologists, everybody is there so that we're able to help each other thrive in a really beautiful environment.
But then do you think the bigger issue, and it's a difficult question, but do you think the bigger issue is the food industry and how they market, or do you think the bigger issue is the lack of education, for example, in schools or around?
I think it's both. I think also I always want to say this, that the food industry is an industry. They are there to make profit for their shareholders. They're not a public health entity. So I don't think that the food industry, a lot of them are doing very novel health promoting things they're working really hard to try and improve things. But so it's the regulations, it's the regulatory bodies that should be spending more time making the regulations stricter and pro-public health and innovating and updating the regulation. Like, we can't have the same framework now as we did 15 years ago. Yeah. Food is made very differently now. We have lots of additives, we have lots of processing styles and, not styles, but processing sort of steps that didn't really exist 15 years ago. So you have to innovate. So it's the regulatory bodies that spend quite a lot of the time regulating things that are quite minor. So you see, and you're like, really, is this what you're picking on right now? Look over there. So, like, a classic example, I did some work for the World Cancer Research Fund this year, helping them with their, they had a big sort of cancer prevention work they did this year. And, you know, alcohol, class 1 carcinogen, to this day, there's no warning about alcohol causing cancer. Let's tackle that. How about we actually inform people on pack when they buy their vodka or whatever, what about if it says like health warning, this is actually problematic, not just cancer. Alcohol causes a lot of problems, right? So we're sort of faffing around telling off smaller brands for overstating their claims or whatever. And in the meantime, we're selling products on our shelves that are directly contributing to shortening our lifespans, increasing the burden of chronic disease. It's just the priorities are a bit all over the place. So less like big food is scary. They're just companies making money, right? But it shouldn't be at the expense of public health. And it's the governing bodies that are supposed to be that police person controlling those things. So that's one. And education, on the flip side of that, if we can help educate people better, and actually this is like a massive ZOE principle, right? If you can give people the tools to navigate the environment as it is with more confidence that it's for their health, it does help. So if we can educate people to understand, okay, don't believe front of pack marketing. If it needs to have some sort of like label and front of pack claim, probably isn't good for you. Broccoli doesn't shout about how good it is on front of pack. It just doesn't need to. It's a whole food, right? So if we can help people to understand, like, be wary when something on front of pack is like contains all like 25 essential nutrients for this and this and like, why are you telling me this? That's fair. But also giving people actual tools, right? So in our case, our app, you open the app, scan a barcode, instant feedback on whether it's good for you or not. That's it. You don't even need to think.
Yeah.
I have an online course with Imperial College, and I have a whole module on reading front and back of pack labels because it's complicated. So like if you want, absolutely, if we can educate, so the course I have with them is really for healthcare professionals and for policymakers. But if you don't want to do that, you can, tools like ZOE help you to get instant feedback on like, okay, is this good for me or not? Get a scan, yes, no, move on, compare it with another product. You know, classic examples of this are yogurts, bread, the bread aisle. People are so scared of the bread aisle, they don't know what to do with it anymore. They're like, can I eat it? Can I not? Which one? So it's like, so education does help, but sometimes education can be quite tricky when it's such a loud environment with lots of noise and claims and then lots of fear mongering online where like all the bread and supermarket is going to kill you.
Yeah. Usually, I mean, it's an entire food group that you're just not allowed anymore.
It's like, oh yeah. And then, you know, yeah, so I think the online noise is complicated. So when you say education, more than 60% of adults get their information from the internet, specifically social media.
Yeah.
So if you're going on Instagram or TikTok for your education, that's a problem because only 2% of health information on TikTok was found to be accurate. So we also need to help people understand where are the good sources of education? Where can you get evidence-based education? Funnily enough, it seems like China is ahead of us now. They've made it illegal for anyone who doesn't have a degree or like an actual registration. If you're not a registered professional in the area of law, medicine, health, you cannot post on social media.
Oh, wow.
Or about those topics.
Yeah.
That would be great. Let's do
Yeah,
that.
yeah.
Wouldn't that be great? So like even, you know, I'm a registered nutritionist, but it's not a legally protected title. So somebody could do a weekend course and call themselves a nutritionist, or someone could be like, well, I ate breakfast today, I'm going to call myself a nutritionist.
Yeah, I mean, the amount of nutritionists I've seen online is immense.
So
and
again,
every single one of them has a different take on how you should eat.
And how do you discern between them, right? How do you say, sometimes they have really credible titles as well. People have like genuine, you know, letters and names. So it's like, well, they seem legit. But I often say, you wouldn't go to your plumber for your electrics. So just, and I have, you know, as I said, I educate medical students and medics. So it's not about shade on anyone else. But if I turned up in someone's feed telling them how to look after their dialysis for their kidney health, I would never do that. I don't know how to do that. I could look it up, but hell no, that's not my lane. Yeah. So it's about also giving people, you know, giving them the confidence to question, actually, is this person the right person to follow for this piece of advice? Or ask questions like, can you send me this paper? Like, where did you get it? How is this completely against guidelines? Yeah. Why is what you're saying the opposite of what my doctor has said? Like, questioning people, especially online, is super important. And then trying to find some evidence-based outlets that do a good job of being more evidence-based. Like they might be less flashy and a bit more boring, like the Harvard School of Public Health site. But there are websites do exist. Obviously, ZOE, all of our newsletters and all of our articles that we put out are all written by a science writer and checked by a healthcare professional. So it's like there are companies that do spend good time making sure that the information they put out is evidence-based and isn't just, well, sometimes just made up.
I mean, I think the other problem there now that I see is that, especially with the book Ultra Processed People, I think you mentioned it, you kind of see a lot of people now not even trusting the research. Like I think there was that skincare, there was a something where everyone was speaking about not using sun cream, and then any doctor that came out and said you should be using sun cream, everyone was commenting in the comment section saying, I bet you're backed by the sun cream industry, all of these things.
All the time, honestly.
So how are you then meant to know who to trust? Because I think nowadays a consumer will see something, oh, it's backed by research, or who's paying for the research, and no one wants to do that digging, and so they just say, I don't trust anybody who's a professional anymore. Yeah. I'd rather trust the guy that, you know, solved everything through his nutrition and now is telling me how to.
Yeah, so I think there's this like distrust of research is quite a big thing, actually, and COVID made it worse. Yeah, if not jump started it in a way. And it's this idea that for some, if if a piece of research is funded by an industry that could benefit from the research, then it must automatically be flawed. That's not actually how it works, right? So all drug RCTs are paid for by the manufacturer making the drug because it costs millions to do them. And the purpose of the research is not to prove the drug works. You have to prove efficacy and safety if you're even allowed to go on the market. So I think oftentimes people forget that the way research operates, when you register a trial and when you run the research, there's lots of safeguarding in place to make sure that it's independent, that when you, for example, if a piece of research is industry funded, then often what will happen is external blinded statisticians will be paid who have no idea what the brand is. They just look at the data and tell people the direction, and they're removed from the entire research group. So there's actually lots of safeguarding in place. Also, lots of industry-funded research proves that the bad thing for the industry. So, for example, there was a recent study that was conducted, paid for by the Danish dairy industry, to look at whether eating butter was better or worse than eating and cooking with seed oils. And came out, the results showed that the butter group did a lot worse in terms of inflammatory markers, heart disease markers, all the things, compared to the seed oil group. And the dairy industry funded it. It still got published because industry can fund research, but if it's well conducted research, it will just present the facts of the research. It will not be, you know what I mean? So it won't be corrupted. It's not automatically corrupted. Now, of course, there are examples of research that's used to detract attention. That's different. Now, even Chris Van Tarleton, ultra-processed people, like, there's a lot of the work he cites in the book is research. So he's not discrediting all research. He's a research professional himself. So there's a bit of conflation around. It's good to question it, but this is also where we have the hierarchy of evidence. So one single study isn't enough to make a decision on a specific question or a specific problem. That's why you then have reviews, systematic reviews and meta-analyses that are conducted by entirely different groups. And they will look at all the research published by lots of people and then weigh it all up together to see whether there is a direction for, does drinking lots of soda increase your risk of type 2 diabetes? You look at lots of studies and you can come to a conclusion, yes, it does, right? So I think distrusting all evidence is problematic. Now, if what you're saying is, not you, but if what people are saying is we need more independently funded research, great. But right now, the NIH has just been defunded. And that is like government money funding independent research for health. It's at risk. It's like it doesn't necessarily, you have to have a little bit of both because there isn't enough funding from governments to conduct independent research all the time. It's quite rare. So there's NIH in the US, NIHR in the UK. They do fund a lot of research. But then people will say, well, it's government funded. It's like, oh God.
Yeah, I mean, that's always a problem.
So who's paying for the science?
Yeah.
Okay, because by the way, being academic is not a high paid job. People who want to be rich when they're older don't go into academia. You do it to move science forward and to help improve health or improve your science, whatever field you're in. And I think it's really dangerous to write off science if it's funded by an industry. It's worth looking through and seeing what they did to make sure that it's as objective as possible. But well-conducted industry-funded research still contributes to our evidence base. And the one that's not well run, the ones that don't put enough guardrails in place to make sure it's really objective, they get weeded out at the meta-analyses. When you do the reviews and you review the strength of the evidence, one of the major things you look at is how well conducted the research was. And if it comes out as being weak, it doesn't contribute as much to the overall rating.
So did you, were you with ZOE since day one? Did you join them at the really start?
No, so ZOE started in 2017, so a long time ago. And it started with running these clinical trials that would help inform the product. So when we talk about being a science-led company, we literally mean that for years, all we did was run clinical trials. And at that time, Professor Sarah Berry, Tim Spector, they were sort of leading that work to build the trials and get them started. Then I joined actually during COVID, when the whole company decided that they wanted to pivot their efforts. It's like, okay, they were building this amazing personalized nutrition app, but the whole world was in lockdown. And of course, Tim is a really well-known professor of epidemiology. He understands a thing or two about the those sorts of problems. So he said, let's build an app that can actually help people in real time understand what's happening with the virus.
Oh, interesting.
And the board were like, good idea. So all of the company resources pivoted to that.
So this was the COVID symptom study?
Yeah.
Oh, I see. Okay.
The COVID symptom study app, separate to the ZOE nutrition app, which was being built in the background and then dropped for the CSS. That was built specifically to help with the pandemic. And so a lot of the research that the team was doing on nutrition as well, a lot of those scientists started publishing on COVID, just basically trying to do something useful because it was such a weird time. And so it was during that time that Tim asked me whether I would join ZOE and help to shape the nutrition product that was to come out once everything had calmed down. And so I started consulting with them at first, mostly around how to deliver nutrition advice in a way that was useful, practical. I work clinically, so I'm used to speaking to people and understanding what the barriers can be and how specificity helps. And then from there, I just started working with the product team, then the science team. So more and more and more, and then eventually I was like, fine.
And then, and so which year did the app actually was it released? Which year did you
22.
launch? 22.
Yeah.
And so what happened kind of after that from the business perspective?
Yeah.
How quick was that growth? What did you?
When we ended up actually launching the app and the test kit to the market, it was a huge success. It was really exciting. 200,000 people signed up for the wait list.
How did you have 200,000 people sign up?
Well, we had started building the community in 17-18 when we ran our first clinical trial, talking about like we're doing this huge clinical trial.
Community on social media?
Yeah.
Okay.
So social media, if you want, and also email. If you want to find out more about ZOE, sign up here. And then during the COVID symptom study app time, Tim, from his home, did a lot of updates on the virus, what the data was showing us. So a lot of people started following Tim for advice at that time. And ZOE put out very useful newsletters during the whole time. Here's what you can do. We did publish on things like dietary supplements and COVID, diet and COVID. So help people to understand like what was worth doing and what wasn't. So actually the overdosing on vitamin D wasn't going to protect you from COVID. Things like that. That helped to build trust, but also to build an audience that was interested in what they could do to help improve their health outcomes.
Yeah.
And that's really the core of ZOE is empowering people to improve their health every day by themselves, right? So that audience grew and grew. The podcast, we launched the ZOE podcast, I think that was in 21 actually. And that was something that we felt there was like a space for evidence-based like experts to actually bring their voice to an audience. And that did really well. So we also had a really good, strong audience from our podcast who just really liked hearing firsthand from world-leading experts about their science and how it changed their lives, how it can change the listeners' lives, sorry. So by the time we launched, we had a good presence, I guess, but it was just also, like our presence is much bigger now, but I think people were interested in doing something for themselves. So it was a combination of timing. Obviously, the pandemic also brought people much closer to wanting to prevent disease. It was an interesting...
Yeah.
I don't know if we've gone back. but like at the time, the interest in health and taking ownership of your health was huge.
Yeah.
It really transformed the way people thought about it. Prevention became much more front of mind, I think. So it was a combination of timing, the service that we put out through the COVID symptom study app, and so the community we built with that. Remember that the COVID symptom study app was actually a community science project because the data from people logging helped to literally fed into WHO's recommendations.
Wow.
We discovered anosmia on our app
Wow.
thanks to our members.
That's incredible.
Because we didn't know it was a COVID symptom. And so, you know, people logging daily in their app directly contributed to the way that the pandemic panned out, how we understood the virus, how we treated it, which is really cool. I mean, I think people felt really proud of being part of that.
Quick break from the show. If you are a healthcare business and you're looking for new video assets, whether that be sales assets or social media content or commercials, that is exactly what we specialize in at Talking Pulse. Shoot us an email at dasha@talkingpulse.com or follow us on LinkedIn at Dasha Angelova or Martini Sue, and we can help you out with that. Yeah. And how much of the, because there's a lot of, I feel like in the health tech space, there's so many kind of businesses trying to build that trust. And interestingly, you had kind of also Tim Spector as the face of it. How much do you think having a singular face, a singular actual person that you can look at, how much did that actually impact from a marketing perspective, that trust building?
Yeah, I think it's massive. I think Tim, having an actual expert, so you have to remember, Tim's an academic, right?
Yeah.
So he's in his 60s and he was happily running amazing trials and doing great science. He was never in it for the fame. So, but as it turns out, having a human who cares, sort of like allowing people, just gifting his expertise to his audience is great. It's a good thing. And so I think it is really important. And I think it helps people to see that there's a real human being who actually cares about the mission of the company. So, I mean, we didn't, as I said, it happened to us in a way. We didn't manufacture, of course you can't manufacture a pandemic, but it does definitely putting Tim front and center and being like, actually, Tim, you're the best person to communicate this. Can you, so we're getting him a little camera for his computer and just being like, can you explain what's happening, was really important. And I think it was really useful for the community, for the people who wanted to know more, who wanted to be, my mum watched his updates religiously.
That's amazing.
No, she really, she was like, hang on, I need to, and I think it makes a difference when you have a consistency and someone who is an expert and a professional in their field communicating things in a very responsible way is really important. Now, most scientists, academics aren't very well trained in communications. So oftentimes when you ask, I've worked with scientists where I've been like, this is a really important piece of work. It would be brilliant if you could communicate this to an audience. And they're just like, I just don't want to. It's not what they want to do. You know, often, not always, but often scientists want to do the science and publish it, and that's it. So it's also about how can we help those scientists who are open to learning and want to discuss it further. How can we help them with the tools? So Professor Sarah Berry is a great example. She is our chief scientist. For a very long time, she didn't do public speaking or she didn't do so much of the communications, but now she does. She is fantastic at it. And it just takes a bit of confidence building, a bit of practice, and a bit of, you know, understanding who your audience is. So when you switch from presenting at academic conferences,
it's a very different language.
Very different vibe as well, like very different vibe. But once you get it, it's hugely helpful, and it's really, I think it's much better than always having an intermediary or trying to use, you know, a celebrity endorsement. Those are all important, but I 100%, I think Tim being such a good face of what we do 100% helps with community and with trust. And I think most people resonate with people. So that's what it boils down to.
And I think interestingly enough, actually, people are also really, they actually really want that medical professional to be telling them this information. I see a lot of the time now, if somebody who does have that background gets online and starts speaking, people are actually like immediately there saying, thank you for telling us this from, you know, your perspective. I wanted someone who's actually credible to be telling me these things.
I think people want to have trusted information from credible sources. I think, unfortunately, social media at the moment, like the loudest voice does tend to get the most traction.
In nutrition especially as well, I feel.
It's just, again, I feel that for the audience, it must be quite annoying and tiring. And I get told this a lot because people will send me DMs and they'll say, what do you think about this advice or this person? And I'm like, unfortunately, they're not particularly well trained to communicate that piece of information, and they're like, how are you supposed to know?
Yeah, so how are you supposed to know?
Well, bring a law in, which means that you follow China's footsteps and just like ban people from giving health advice online unless they have qualifications to do it.
But
right now, yeah. So right now, I think the best things to do are to look out for the qualifications someone has. So, as it's the example I gave earlier, if you suffer with kidney disease and you're looking for evidence-based advice on how to manage your kidney disease, look for kidney specialists, go to websites for charities or hospitals that have that specialty, and use that to start building your fact file. If you're looking for, I'm just picking kidneys because it's just one example, but if you're looking online and there's somebody online who's saying you can completely remove your kidney disease 100% with my protocol, and they're trying to sell you something that's a protocol, and when you look them up, they have no affiliation to kidney research or a nephrology like specialization, that's a red flag. Yeah. So if you Google people nowadays, you get a pretty good sense of whether they have qualifications, whether they are affiliated with an actual university. Now, there was a very famous influencer who pretended to be affiliated with the university.
Wow.
And the university had to put out a statement to be like, this person's not associated with us. So that can get tricky, but you will find it. You will find out if you look on the university website. And it's a bit of work, but do they have qualifications to be speaking about that topic? So for nutrition, are they a nutritionist? Are they a registered dietitian? Or are they an active research scientist in nutrition? That's basically it. Those are the three options. If the answer is no, then just take it with a pinch of salt and consider whether actually they might not be the best or the sole voice to get nutrition advice from. When it comes to like health, medication, changing medications, medical doctors, you really try to stick to the specialty as well. So I've got people who, for example, have a cancer diagnosis and they might have to undergo chemotherapy. Don't look online for advice on that. People do it. It's a terrible time. My dad had cancer. He went online. So there are a lot of awful people, because you have to be pretty awful to prey on cancer patients, who will put out protocols, magic potions, really stick to the specialty. There are good cancer specialists online who put out evidence-based information. But so find out, are they the right type of professional? Do they have a specialty, especially if you have a disease? Do they actually work in that field? And are they affiliated with a clinical practice at university? Do they have the qualification? Are they registered in their profession? Massively helpful. Then from there you can make a decision. I would still urge people to not take all of their advice from creators, even if they are qualified. Doesn't matter. Make sure you have a professional, ideally a medical professional or a nutrition professional you can work with. But certainly, look at books, look online, speak to your friends and family as well. If your friends and family are like, that sounds really weird, it's ringing a bell. Just really be open to it. Maybe not being, the best. Take your sources from multiple places. And then I feel like online, there is definitely a group of us that back each other up, who have qualifications, who are registered. So you'll see there are echo chambers online of people who sort of back each other up. And that tends to be because we have the evidence-based background, or there's also similar for quackery echo chambers where people who are against the system, who will tell you something that no one else will tell you, don't listen to the scientists, they all talk to each other, and there's an echo chamber there. So one of the things that I find really, if you have a friend or a partner, ask to look at their Instagram algorithm. It will be completely different to yours. It will be completely different to yours. And it can help you to see, this is the kind of content that you're seeing that's different to mine, and that's why your belief system is so different, because we consume content in parallel universes a lot of the time. So just have a look around, be curious, and as I said, you can actually, sometimes you can even Google or chat or whatever, search, is this person a quack, or are they credible? And it will come up with some sort of answer.
And then what about for yourself, kind of on either on a career front or a personal front, you have a lot of different things that you work on. What's your personal goal, I guess, at the moment? What's your personal...
So my goal was always to try and help improve the health of as many people as I can using evidence-based science and tools that are actionable. Mm-hmm. So to be honest, like I'm doing that right now. I'm in my goal. I'm living it. And I'm doing it in as many ways as I can to reach people where they're at. So whether that is writing books, coming on podcasts like this, whether it's unfortunately on social media. I really resisted the social media thing for quite a while.
Can't resist it long enough.
but it's, and you know, I'm never going to go viral. Like my content is evidence-based, which means it's not that clickbaity. But if it helps 3 people, like when I get a message being like, thank you so much, this really helped me, I'm like, done. That is all I'm here for. Educating, so teaching at Imperial, teaching medical students. And of course, all the work, what's amazing about ZOE is we reach millions of people. And we're very careful with the content we put out, the advice we give. And I feel like, for me, that is amazing to be able to contribute to something that's much bigger than just me, right? And it's the same with the clinical practice I have, Well-Founded Health, with really good people just doing good work and helping to change lives in different ways. So I think my goal is this. I'm here. Here I am. I'm going to keep doing it for as long as I can.
And actually, an interesting last question. With your kids, one of the hardest things I think that people find is actually also convincing their kids to, like educating them around the food environment, educating them how to eat properly.
It's not hard at all with kids. Depends what age they are. So the younger the child is, the more you can influence their choices and the way that they choose foods, right? So with parents have a huge job anyway. It's a lot, obviously. It's a huge job. It's the most responsibility you'll ever have, having a kid, because they depend on you for everything. So the best way to think about it is if you can build your home environment to be the kind of environment that you hope they will have when they're older. Yeah. So, buy whole fruits, give them like fruits and veggies as snacks, expose them to beans and lentils, and make sure they love eating like fish. Give your kid sauerkraut, give your kid sardines. When they're toddlers, they will try it, especially when you're weaning them. They'll put anything in their mouth, honestly. So it's a problem, actually. So the thing is like, the earlier you can expose them to these foods, the more normal it becomes. And if that's what they're used to at home, that is what they'll come to expect outside the home. And children are very receptive. If you say to them, eating this food is going to make you feel good. This is a sometimes food, this is an everyday food. Like, make it simple, but it absolutely works. Like, and building the environment, as I said, then they start to go to school. School food can be rubbish. I mean, my eldest, she'll come home and I'll say, well, what did you have for lunch? Well, I was in a rush today, so I had a baguette with cheese. Like, is that it? She's like, yeah. I'm like, great. So, like, school food is difficult.
At least it's not processed meat.
Yeah, there's that. But, you have to work with what you have and build the home environment will cover their breakfast and their dinner most of the time. Some children are in school for prolonged hours, so that becomes trickier. And the weekends, just try and build as much of that in as you can. Prioritize it. But then when they get to 4 or 5, they start being interested in what's happening in their bodies. Use that. Tell them about belly bugs. Tell them when they eat, they're feeding their belly bugs, and their belly bugs are going to make them stronger. They're going to make them faster. They're going to make them better at maths. Like, for kids, they understand that their body is influenced by the things they do. Yeah. So also when they're not feeling really well, there's an opportunity there where you can say, don't worry, your body is strong. You've got everything you need. You will recover. Kids aren't like, they're sponges. They're ready to learn. So if you're ready to tell them, they'll take it, they'll do it. And remember that as a parent, we have the responsibility to also say, this isn't going to help you feel better, feel healthy. I had a real struggle with, the fact that, slushies are actually even legal to sell. Because the glycerol in them, especially in children under the age of 7, actually puts them at risk of a hypoglycemic shock and hospital. So their kids die.
Like the blue slushy.
Yeah, the slushies. It doesn't matter about the colour, it's just slushies in general. So the glycerol helps the ice stay liquid, so it doesn't just become solid, right? It's like a hard rock. So it's kind of, slushies are weird because they're ice, but they're slushy. Yeah. Now, We know this. Every year, like, I don't know, 20 to 45 children end up in hospital because of slushies in the UK. Why are we selling them? But they're at every playground, every children's party. And I had to really, you know, my child was like, why am I not allowed it? All my friends are allowed them. I just really want one. I really want them. I want to try it. And to then explain to them, this could actually make you really sick to the point where mummy has to take you to hospital. We don't want that, right? They will get it. Like if you explain things to them, obviously you don't want to go too far down the route of being like fear-mongering them. But if you explain to them, it's really not going to help your body.
Yeah.
I remember candy floss. Mummy, I really want to try it. It's disgusting. You're not going to like it. Mummy, you want to try it? Fire. I spent a fortune on a candy floss at like Disney on Ice or whatever. Outrageous. They had one mouthful and they were like, there. I was like, I told you. And then it was like, if they ever ask again, I'm like, do you remember when you had it in your hair today? Oh yeah. So it's just being part of that education is so important. Let your kids peel the potato, chop the veg, get them involved in cooking. My kids love to make their own snacks and they'll sort of take, you know, they'll like take a banana, take some nuts, put it in a lunchbox. Let them play with food. Let them have some agency over what they can eat. And then you can really help to build an amazing relationship with them with food. Because what I see in clinic now is people who have grown up with a bad relationship with food. They fear it, they avoid it because they have a belief system that anything they eat is going to make them fat, or anything they eat is going to make them bloated, or anything they eat is going to... So like there's real fear around food, and it's really hard to undo later.
Yeah.
So as an adult, if you can help your children have a really good relationship with food, where they know that it can help them be strong and fast and it can be delicious, and there's sometimes foods, everyday foods, and fruits and veggies are important, and beans are really good for you, and make it fun. My 5-year-old's favourite song is beans, beans, they make you fat, but they also make you very smart. And she just sings it when she's eating beans. Just make it, like, food is an essential human experience. We evolved over millions of years, hunting, gathering, foraging, all day, bringing it back to our tribe, cooking, preparing, sharing, and then drawing about it on cave walls. It was our entire lives for a very long time. And now we're at this really weird time where it's become such a commoditized part of our lives where people are like, oh, I don't have time to eat, I'll just drink my lunch. Whoa, like we need to take a massive step back and just think about fundamentally, food is pleasure, food is joy, food is connection. It's important for social health, and it's critical for our physical health. And the last thing I'll leave you with is when we look at like the exposures that contribute to ill health, and we look at dietary exposures, the foods that we don't eat enough of are much more important than what we eat too much of. So when we talk about a diet that's too high in ultra-processed foods, a diet that's too high in, you know, empty calories, which is a weird term, what we're actually saying is these diets that are high in these foods that aren't helping us are really low in the foods that we know directly improve our health. So it's a diet low in whole grains, a diet low in nuts and seeds, a diet low in legumes, a diet low in fruits and vegetables, and a diet low in omega-3 fatty acids. Those are the top 5 dietary factors that contribute to the most deaths globally, 195 countries.
Wow.
So we need to put that emphasis back on what is missing from your plate. Because once we fill that, then you'll have less of an appetite for random protein ice cream and, you know, bars that don't have anything in them. There's so many bars on the market now that don't have any actual food in them.
Yeah.
It's really interesting. They have like isolates, concentrates, sweeteners, emulsifiers, but there's no actual food ingredients. That's
But then
wild.
they'll also be labelled as high protein, so...
Yeah, high protein, low sugar. You know, it's good for you.
Okay, thank you so much, Federica.
Yeah, you're welcome.
This is great.
Thank you for watching Good Morning Harley Street.
If you are a clinician looking to build your thought leadership, check us out on LinkedIn, Angelova and Martini Sue. And if you're a clinic looking for support with your marketing or with your video assets or your sales assets, then check us out on the same platforms.